Okay, so what we're looking at here is a hard corn and some callus underneath the fifth metatarsal head of a patient. So what we go ahead and do first is just remove all the callus so we can just see the extent of where the hard corn is. And so you can see me just here debriding all that hard skin. So what causes the hard skin is just pressure. So particularly under this fifth metatarsal head, you'll find there's more pressure, which causes the skin to harden. And unfortunately, when that continues for too long, you get this central really hard section called a corn or a haloma durum. So what we go and do is remove as much of the callus as we can, so we're only really just dealing with the hard corn that's left here. And then we go and core out the central section of the very, very hard skin, or the corn. So a corn and callus is sort of on the same continuum. So the corn's just a very, very hard section of callus, and you get it in the central section. And the reason why these happen is because pressure causes hard skin, and hard skin actually causes more pressure. So you get this growth right in the center here. They're very painful to walk on, but they're pretty easily removed. They can become a little bit painful as we go and get this last central section out, where we get to the junction of the living and the dead skin. So that can be a little bit sharp, almost like we're just pulling hairs out of the foot or removing a little splinter. So usually this can be done with no blood, but sometimes we get a little bit of blood as well, just as we approach that barrier of the living and dead skin. So we go and core this out, and this will regrow. If we don't change anything to limit the pressure, it will grow. And here you can see the corn we've removed, and then we'll go back in there and just really smooth those edges off, make it all nice and comfortable for the patient. And we'll review this in about 6 weeks.